Hello and welcome to the program. I'm State Representative Rosemary Brown. Since the inception of the Affordable Care Act, I've received numerous phone calls and emails from you asking for help in wading through all of the information. And even though it is a federal program, Pennsylvania, under the Corbett administration, has had some choices to make as to how the program will operate here in Pennsylvania. I thought it would be beneficial to provide you with background information on what the law means and what Pennsylvania is doing in regards to it. My guest today is Whitney Crossate, Executive Director of the House Health Committee and also the legal counsel for the Majority Caucus. Whitney is well versed on the Affordable Care Act and she's here to share her knowledge with you today. Whitney, thank you so much for joining me today.
Happy to join you.
Now obviously we are underneath a great amount of information and turmoil as far as the Affordable Care Act. And regardless about how you feel, if you're in favor of the Affordable Care Act or if you're not in favor of it, we are dealing with it at the federal level and at the state level and as constituents. Correct. And so there's a lot of information out there, and unless you follow it continuously, it can be very, very confusing. So I thought this show would be very informative for people to get a little bit more information, and if they have more, they can obviously call my office as well. And or maybe even call you at times. We'll see. But Whitney, before we start, let's just get a little bit about your job and how you became involved with research with the Affordable Care Act.
Well, I joined the caucus in 2010. I previously had worked in the field of medical malpractice, so I've been working in the healthcare field now for about 8 years. Healthcare was my background, and so when I joined the caucus, I was the counsel assigned to the Health Committee. The Health Committee deals with a lot of constitutional issues and other, legal issues with not only the Affordable Care Act but other federal health care acts. I have remained, on top of what's developing with the Affordable Care Act. It's confusing. I think that's one of the biggest problems we have is because so many regulations come down from the federal government, from the varying agencies, and change a lot of the aspects of the Affordable Care Act. Define employer under the IRS, or they define how long a work week needs to be a full-time equivalent. These were all done under regulations, not in the act itself. So the law has evolved over the last 3 years to where we are now. And you're absolutely right. It doesn't really matter how you feel about it. It's here. It's moving forward. We are now in the point where the exchanges are open and operating. And come January 1st, it looks like we're going to have that individual mandate that moves forward, whether we like it or not. Right.
And let's backtrack just a little bit because we're going to take it to a pretty basic level right to start.
Sounds good.
What is the purpose of the Affordable Care Act? And we know what that is, right. but let's just start there just for a generic for the viewers, what the full purpose is of the Affordable Care Act.
Absolutely. The purpose of the Affordable Care Act, as stated by the federal government, is to provide health insurance to those that are currently uninsured. At the time of the Affordable Care Act that it was drafted in 2010, there were about 40 million individuals living in the United States without health care. That was either individuals who chose not to have health care, weren't offered health care through an employer and couldn't afford it otherwise, or just couldn't afford to have health coverage but weren't eligible for another state or federally run program. There's two tracks to getting these people health insurance. One is to expand those that are eligible for Medicaid. So that's the Medicaid expansion that we hear about frequently. The other one, which is what you're hearing about most often now, is these health insurance exchanges. They opened in October 1st, and it's a way for individuals to shop for health insurance. The best example I've heard is that it's Travelocity for health insurance. Right. So it combines all the health insurance plans. They're private plans. They're not government plans. This is your Blue Shield, your Aetna, your Cigna, that are offering private insurance. And it's subsidized at some level if you are between a certain level of the federal poverty level. And it's 138 to 400% of the federal poverty level. You can get a subsidy to help you pay for the insurance.
And I think when you talk about people that were uninsured, and like you said, some people chose to not be insured, and I have actually gotten some feedback on that as well, that I chose not to have that in my family budget. Correct. And now I'm being forced to have that in my family budget, and I don't want to include that. So you get all different types of feedback, people that really do want the insurance at an affordable rate, and then people that say, no, I'm fine with my decision and how I've decided to run my household with
Right.
insurance. But when you look at the health exchanges, now, if your employer offers you insurance at this time, this is where we see a lot of things happening
Right.
with the hours worked and your employer, what they're offering you, and how this is kind of finagling and changing the environment
Right.
of our business employment. A lot of things happening here.
Right.
Let's talk about that a little bit. So if you're going to look at the exchanges or the way you're going to get insurance, there's pretty much 3 different ways that you're going to get insurance at this point.
Currently, private insurance, right. You can either get it through your employer. That's the standard way most people still receive their insurance through their employer, and it's offered through the employer. And even employee plans have to meet the essential benefits, essential health benefits that are required under the Federal Affordable Care Act. So it's good insurance. It's actually usually much more comprehensive insurance than you could get through the health insurance exchanges. You can get insurance through a health insurance exchange if your employer doesn't offer insurance or the insurance your employer offers is not affordable to you. You can get insurance that way, or you can get insurance through this, again, the state expand if the state decides to expand Medicaid coverage. That has not been done yet in Pennsylvania. Some states have done it. We have not yet done that. So.
Right. So those are pretty much the 3 different ways that you can get yourself insured.
Correct.
Now, when we talk about the businesses and their decisions as far as trying to stay within the requirements of the Affordable Care Act and the type of insurance that they offer,
Yes.
what are the businesses struggling with right now to say, okay, you have had insurance as an employee,
Right.
but now as a business owner, I am under a certain standard.
Right.
And what are they up against?
Well, since they have to now provide these essential health benefits, they include, and things that most people probably have heard about, you have to provide birth control now at no copay. So an individual will go in and pick up a 3-month supply of birth control pills and pay $0 at the register. The employee has to pick up the entire cost, or employer has to pick up the entire cost of that, or contract it as part of their insurance. Preventative care visits, so those well baby visits, your annual checkups, all of that, that's again, no copayment. So it's to encourage, the purpose of it is to encourage you to go and get those preventative services done to prevent a bigger problem down the line. However, the cost is falling onto the employers on a great deal of this. There's, some things that people like. There's no pre-existing condition. The rating for individuals, it used to be a 1 to 5. That means your sickest person would be a 5 and the healthiest would be a 1. So $100 versus $500 premium. Now it's a 1 to 3 ratio. So the healthier individuals are kind of being pulled up and having to pay more. So the sick don't have to pay as much because of this no pre-existing condition provision. And then you can keep kids on insurance until they're 26. So it's bringing in a whole additional population back onto parental insurance that employers are not used to covering. They're used to only covering up until the person went to, if they were in college and you could prove they were in college, then they could keep them on your insurance. But once they finished their 4 years, they went off. So, there's a lot of there's a bigger population that are staying on these employee plans. They have to have more benefits covered. We are finding that many employers had covered more than the essential benefits. These were good plans. These weren't bad plans. It's just now they have to cover more people, and the cost of it is falling more to the employer than to the individual. So,
are we finding that some employers, if they had offered a family plan, are now doing a straight employee plan and having the family kind of pulled? Is that happening at all?
I've heard that they're doing that. They're just only now providing health insurance to the employee because that's all they were required to do, is provide insurance to the employee, not family plans. They're not required to include family plans. So families are now splintering into multiple insurance plans. So the family practitioners aren't seeing the whole family as a unit anymore. They're going to have to see multiples if that family practitioner doesn't take both insurances. Right. That mom and the kids have one and dad has another, or
which is very difficult, not only for expense reasons but also for patient care.
Correct. There's
for
very
doctors.
little
So-
continuity of patient care. We're going to see individuals having to go to new providers that they weren't having. The whole concept is if you like your insurance, you get to keep it. Well, that's not what we're finding.
Right.
Very few plans actually grandfathered into those provisions that kept the insurance exactly the same from 2010 on. And I don't know if you'd even want your employer to do that because there's so many changes in healthcare and it's so fast moving that you'd want them to keep up with the current technology and coverage of certain procedures. So I think, again, that goes back to there are some good aspects to it. The pre-existing condition, most people
Absolutely.
don't
Right.
think it's a great idea. Keeping your kids on till 26, I was asked that, well, why 26 the other day? Well, if you think about it, that's about the time it would take for an advanced degree, a master's or a doctoral for a PhD, not necessarily becoming a medical doctor.
Right.
I have a JD. I was about 26 when I got it. So that's the age that you can keep kids on if they're going for an advanced degree, and that's the reason why 26 was chosen. So all those things are beneficial. However, you can't continue to push that cost on the employer because it can't be the insurance. Another provision of the Affordable Care Act is that insurance has to spend 85 cents of every dollar it collects in a premium on health benefits. So since they cap that, they can only make 15 cents on every dollar, or they have to return money to the participants. So it really is falling to these employers, and they're getting squeezed from both sides, both from the employee side and the insurance side.
I think when we're doing legislation at the state level and even the federal government, like you said, there's some very good things with the pre-existing conditions, things that people live daily life with and say, well, that's why you have insurance. So there were definitely issues and problems and things that need to be fixed.
Right.
But you're always very careful as a legislator that, an unintended consequence.
Right.
And there always is some sort of, but how big is that?
Right.
And how big is that risk benefit of what you're trying to accomplish versus something else that may be the downside of it?
Right.
And I know that there is a lot of concern that with, like you're saying, with the jobs and the fact of people getting reduced in their hours.
Right.
And losing employment because the cost has become, or it looks like it's going to become stronger for the employer. So that I think is one of the biggest fears that we're hearing from our employees.
Well, the cost of health insurance has gone up every year for decades. I mean, it's one of the fastest growing segments of our economy. So it's always going to increase. It was a problem for employers, I believe, even before the Affordable Care Act. This has kind of perpetuated some issues. And the instability in the insurance market and not knowing who it's going to apply, how many people are actually going to come into the marketplace now, whether through the exchange or through employee plans, has just kind of perpetuated this ever increasing cost of health insurance. So it may level out, it may not. It's kind of one of those times. You can't really predict the future.
See how it comes.
Yeah.
My biggest concern is always also the quality of healthcare.
Correct.
And coming from a healthcare background, you look at that and with a family and with yourself and all the technology and all the new pharmaceuticals that we have and prevention. How is the healthcare going to stay as far as the quality?
Right.
And to me, we should be moving up and moving up and moving up and becoming just top notch in our healthcare because we have the technology and the resources for that. So my thing is always trying to say, where are we going with that, and how is it going to be, that quality that we need? And I'm hoping that it will be.
Right.
But that is something that's very high on my radar
Right.
to look at for the people. And I think that's what everybody wants, is to say, we're America and we should have the best health care, we have the best resources, and that's where we should be.
Right.
So we will have to see over time as we go forward, but that will be one of my focuses as we look at it. But there are so many things that we can talk about. The website for the exchanges, currently now we're taping this, hopefully we'll air this in the next month or so, but we're having some issues with people on the exchange website.
Correct.
Talk a little bit about that and
Absolutely.
what's happening.
Well, I think people need to understand, we get a common question, why didn't Pennsylvania run its own health insurance exchange? And what we're seeing in the federal exchange is exactly why we didn't go ahead and run it. I heard the figure this morning, it was $400 million it's cost the federal government right now to establish the healthcare.gov. And it's only had problems. They had days of beta testing. which is usually months worth of it for a rollout of any like Windows
For
program.
this big, right?
Yeah.
For something this big.
So it's a huge technology platform. It's multiple federal agencies that have to interact with one another. The best example is like if you ever try to go in and track your IRS tax return, the amount of information you need to enter to just get your tax return, your social security number, the amount of your return, and everything else just to verify who you are. I mean, it's the IRS working with HMS, or HHS, working with all these federal agencies to confirm you are who you say you are, your income is what you say it is, so you can get the appropriate subsidy, your family size is what it is, all these.
It's a lot of information.
It is a lot of information.
Yeah.
It's at least 30 different agencies that are overlapping, and it's different technology, and then it's 36 states, and our technology base here in the Commonwealth is different than how the federal government. So having them interact on 36 different state levels, it's a lot of work. So yes, it's been a major problem, lots of hang-ups, lots of, we have an issue, please come back. I haven't heard great things about the call-in even. I now know that is on healthcare.gov. It now has the number at the bottom instead of you having to search through the website for it like you previously did. Early on I had that, took a Post-it note, wrote the phone number on it, and put it on my computer just to help, because that was a common question we were getting here in the district offices. So, hopefully they get it fixed. The president keeps saying that that's what he's pushing to have it fixed, but it is a huge technology infrastructure that needed to be built, and it was extremely expensive. And I'm very happy that we defaulted to the federal system on that, simply because the cost to the Commonwealth would have been exponential. And we would have still had to go through all those things where our system would have had to communicate with the federal system. And the federal system is even having trouble communicating within itself. So
it was a good decision. And we're so concerned with our funding and the state budget and our resources as well. But on that note, we got to take a quick break. We'll be right back with the legislative report.
Did you know? Since 1905, the State Museum of Pennsylvania has been offering an interactive and educational experience of the state's vast history and heritage. Each year, the museum is a playground for more than 135,000 schoolchildren and adults exploring culture and history of their state and country. Memorial Hall features a larger-than-life, 18-foot-high bronze statue of the Commonwealth founder, William Penn, standing right in front of a monumental memorial, the Battle of Gettysburg Pickett's Charge. With more visitors than almost any other Pennsylvania museum, you're probably wondering, what's so exciting? It may be the 4 floors of interactive and displayed exhibits ranging from the Earth's beginning to present day, or the planetarium, where visitors can witness the wonders of galaxies and stars beyond Earth's surface during one of the many shows offered throughout the year. Perhaps it's pretending to put on your lab coat as you view the uncovering of fossilized bones in the Dino Lab interactive exhibit. It offers a once-in-a-lifetime chance to see millions of year-old fossils. Be prepared for exhibits just like ones in the State Museum. Or it's visiting a constant favorite, the Mammal Hall, with full-scale displays of Pennsylvania's wildlife and lifelike dioramas. But the real reason for the State Museum's popularity, the many adventures around every corner, and something for all visitors to experience and remember. Now you know.
Welcome back to the program. I'm State Representative Rosemary Brown. The topic for today is the Affordable Care Act and how it's being implemented in Pennsylvania. I'm with Whitney Crosse, the Executive Director of Health and the General Counsel for our Majority Caucus. Whitney, thank you again for being with us. And we had left on break talking a little bit about the exchanges and some of the difficulty getting into the system. And we hope that that gets cleared up for people before, obviously, January, when everything gets fully implemented.
Yes.
But as we continue the conversation, we were discussing slightly the portions of how you would get insurance, and one of them would be through Medicaid.
Yes.
And let's go again, very basic to our viewers. What is Medicaid? How does it work? And how would it play a role here in the Affordable Care Act?
Medicaid was designed in the 60s to provide health insurance to the poorest and sickest in the country. This is not Medicare. like that, and that's very, very important. This is not the insurance you get after you've retired. This is not the 65 and above. This is not insurance for older individuals or senior citizens. There's nobody that I've ever spoken to that thinks we should, change Medicare, alter Medicare. That's not what this is. There are some seniors that were considered dual eligibles and on both, but that is the, senior citizen that is also poor and extremely sick.
It does get confused.
Yeah, well, I get asked it a lot of times, and that's, that is probably my number one question. That's great, but what does that do for my parents? Or how does this hurt my parents? Right. That's what everyone is concerned about. And that's, I can't say it enough. Medicare, Medicaid, totally different programs. The federal government actually runs Medicare. We have very little to do with Medicare at the state level. Medicaid, we, pay for about 45% of the Medicaid bill. It's a huge portion of our state budget. It's very large. And so we have a little bit more control over the Medicaid piece of it.
And I think that's why
I'm going to put Medicare aside.
And that's why we talk about with the Medicaid expansion
right.
and the amount of the budget that it currently takes.
Right.
And it's such a large portion already that
between
there's concerns.
DPW and education, those are two of our bigger pieces of the pie on our budget. And the Medicaid has been growing exponentially. We have 12 programs currently under our medical assistance, and we call Medicaid in the Commonwealth medical assistance. So it's MA. If I refer to it as MA, that's what I'm talking about, is state Medicaid. And we do a lot of things. We do a program we call MAUD, that's medical assistance for workers with disabilities, and we do Medicaid for kids. We have a lot of Medicaid programs. Most of them are currently run by a managed care organization, so it's a flat rate for everybody. But the benefit package we have in medical assistance is extremely generous, and I don't think anyone recognizes how generous our package is. It grew exponentially through early 2000. It's 18 visits to primary care. You're allowed 18 visits to primary care, covered at 100%. This is not for just the sickest people in.
This is for everyone.
This is for everybody.
Right.
I don't know a single person who goes to their primary care physician 18 times in a year.
You would hope not. And the utilization is not really happening.
Yeah, I was going to say the utilization rate of even primary care visits is about 8 to 10, but we're paying for 18 in case.
When we're not using.
But we're not using them.
Right,
ours is a little over $7,000. I'm pulling these numbers from my head, so I do apologize if I'm a little bit off. It's about $7,000 per person on Medicaid. Okay. The national average is between $4,500 and $5,000. So we are substantially above the national average on how large our package is. It has alternative benefits. Chiropractic services are covered under medical assistance and all these things. So these are things that were added in. Now, the number one question is, why can't we take them out? That's the next question I get, probably most common.
Right, to make it more reasonable, right.
Once I explain how generous the package is. Well, that goes back to the Affordable Care Act. In March of 2010, whatever your plan is locked in, period. They wanted to make sure states weren't going to all of a sudden start ratcheting back their medical assistance or Medicaid plans to make them so unattractive that people wouldn't go on them. We are not permitted right now under federal law to change any plan that we have in medical assistance. So that's one of our sticking points, and that's also one of the reasons why the costs are going to continue to grow, because we're certainly not going to lose a lot of people off of medical assistance. We hope we would. We hope people could move forward and, get jobs and stuff like that. But these, again, are the poorest and sickest in the Commonwealth. And so these are people that we, if they fall into that category, the poorest and the sickest.
Which was made for.
Right.
Right.
We obviously want to make sure they have some health coverage, but, we're kind of in a catch-22 right now on, we can't change the benefit package, but it's growing exponentially, and we don't know how we're going to keep it with our state budget.
And that's where we say, when part of our show today is to show how the federal government comes down to the state level and how we're dealing with it and how we're trying to do our best with our funds,
right.
and while also providing for the most vulnerable citizens, which, like you said, is what it's really meant for.
Right.
But getting the best utilization out of those dollars,
Yep.
and the Medicaid program that we do have that is fair and takes care of our people. Now, the governor initially has something called Healthy PA,
Right.
which is an initiative, and can you discuss that a little bit with us?
Absolutely. That actually falls right into where we were talking. The governor has determined not to expand Medicaid as it stands right now, simply because we can't afford it.
For the reasons we just said.
There's just no way we
right.
can afford to provide this benefit package to everybody. We'd actually be providing a better benefit package than you could purchase through the insurance exchange on most cases. So we don't want to do that. So what we've proposed is similar to at least 3 other states. Arkansas's was recently approved, and the governor made this public on September 16th of this year, so September 16th of 2013. And it's an alternative plan. So we are going to make some changes on the state level on various bills that we had been working on that deal with, the healthcare industry here in Pennsylvania. But we're also going to provide an alternative to Medicaid expansion. It really is expanding the health insurance exchanges that we talked about earlier. Those are those private insurance plans down to 100% of federal poverty level, and helping use the federal funds that we would normally get from the Medicaid expansion population to pay for these private insurance plans. So we're trying to move, let's utilize our very robust private insurance industry here in the Commonwealth and get health insurance for these individuals. We passed Senate Bill 5 in June of this year. It expands the free clinic program that we have here in the Commonwealth. So individuals can go in and get primary care and preventative measures at free clinics, no cost to them, and they can, we can expand these free clinics that we have that are very robust here in the Commonwealth. In fact, they've been operating very well. We've toured a few of them to see which models we can try to replicate throughout the Commonwealth. So there's that. There's getting more individuals into primary care practice. Coming out of medical school now, it's hard to be in primary care. You want to go into, a specialty, you make more money. So we're looking at loan repayment programs to help people go into family practice and stuff like that.
Absolutely.
We have the patient-centered medical home. This is something where it would consolidate all of your specialty care for those, especially with diseases like lupus is one that works. This patient-centered medical home works extremely well because you have so many specialists that have to work with the primary care physician for that patient. And the federal government has recognized that this patient-centered medical home is so important that they actually increase the Medicaid reimbursement rate for a patient-centered medical home, services provided through a patient-centered medical home.
There is so much information on this Healthy PA initiative, and we only have a very short period of time. We are out of time already, but what I'm going to do is I'm going to put the Healthy PA initiative on my website, and if the viewers would like to look at that, they can review it, and they can call my office and discuss it in detail. So we might have you back again, Whitney, as we move forward, but thank you very much for being here with us today. And that's all the time we have for today's program. I'm State Representative Rosemary Brown. If you need assistance with any state government matter, please feel free to contact me at my local office or through my website. That information will be shown in a moment. Thanks for watching. Please join me the next time for Legislative Report.